So the question, what are expectations around immunotherapy as it relates to outcomes and reduction in use of chemotherapy and reduction in side effects? I actually have very high expectations for immunotherapy. We're already seeing some very positive gains in liquid tumors most especially, but increasingly in solid tumors as it relates to immuno-oncology and this notion of precision medicine. So what do we mean by precision medicine? That means to me the way that we can more specifically design and develop and target therapies to particular cancers in a way that is not the shotgun but is more of the rifle approach. So you're specifically targeting certain pathways in the cancer, really getting at that exact tumor versus taking a more radical approach of attacking the body in a sense broadly. So I'm very sanguine about immuno-oncology and its impact in reducing side effects, improving outcomes from chemotherapy or immunotherapy, and also reducing the drug burden for patients. So we're absolutely seeing, while these therapies are not devoid of their side effects, peripheral neuropathy, other kinds of things, they certainly have less profound side effect profiles in terms of febrile neutropenia and some of the more untoward consequences on cardiovascular health and renal health as it relates to end organ damage from the more traditional cytotoxic chemotherapies. So definitely seeing a reduction in side effects associated with these drugs, and from an overall population health where I sit, that means that the impact of cancer, and cancer increasingly is a chronic condition where people are living 3, 5, 7, 10 years or longer, and then you have the untoward consequences of that chemotherapy or radiation therapy that they might have happened 7, 10 years ago. So that's a very important positive impact of immuno-oncology. Yeah, so the question is about combination therapies in the context of immuno-oncology or immunotherapies. Sure, immunotherapies are used together with more what we might call traditional chemotherapy. Immunotherapies are used in combination certainly with surgery, or immunotherapies are used in combination with radiation oncology, just as we've been doing the last 30 or 40 years as we've looked at cancer and looking at multiple ways to treat that cancer, to attack certain aspects of the tumor and how it evolves. That said, again, the holy grail of being ever more targeted and selecting and avoiding some of the very significant untoward side effects of, again, as I said earlier in the discussion, the shotgun versus the rifle approach. So absolutely there are multiple pathways that tumors act on the body, and in the move from DNA to RNA to proteins, and studying that. Certainly this area of immuno-oncology includes the development of cancer vaccines, which again is another very exciting area.